Today here on the BBC, and now concerns over a digital patient safety system used by some NHS mental health trusts. It's called Oxevision. It uses infrared sensors and cameras in patients' bedrooms to monitor them 24/7. Leicestershire's Mental Health Trust gave evidence at a public inquiry today. They were explaining why they've actually abandoned this system. But in neighbouring Derbyshire, NHS bosses, they're looking to expand its use. Well, our health correspondent Rob Sissons is here to tell us a bit more about this system. And it does sound very controversial.
It is controversial, and there are different approaches to it at different trusts up and down the country. That's emerged. And if we take a look at it, we've got some pictures. This is the system. You might miss it. It's a box. It's got those infrared sensors. There's a camera in there. The makers of it say it's all about safety. Supporters say it can help a lot. It can measure things like breathing. But campaigners say there are issues with privacy and dignity.
This isn't just a debate about privacy and dignity versus safety. We also have enormous concerns about the safety of the system. So the vital signs monitoring technology, for example, only works within a certain frame. So a range of heart rate, for example, between 50 and 130 beats per minute. That's a healthy heart rate. Also, it doesn't alert for the deterioration in vital signs.
So, Rob, this was all piloted in Leicestershire, but then they decided to drop it.
They did a pilot project and they abandoned it last year. They had a consent system where people had to opt in to use it, and they found that most patients, when it was explained, didn't take it up. And the main advantage that they expected was to do fewer observations at night. But at the end of their evaluation, they said the benefits weren't, they thought, enough. A senior manager gave evidence today at the Lampard Inquiry, and here's what he had to say.
This was about providing patients with the best circumstances at night in order for them to get rest. And that was it, really.
But the Derbyshire Mental Health Trust, they remain committed to this?
Yes, they've got it in 11 patient units at the moment in Derbyshire, and they're going to be expanding it to a few more, they hope, by 2027. They think it has safety advantages, so difference of opinion there. As for the makers of this technology, it's called LIO Health. They gave us this statement. They told us technology has a vital role to play in supporting safer inpatient mental health care, an area without any medical device technology until Oxevision came along, they say. The impact of the technology, they say, has been significant. In one trust alone, they point out, the system's helped staff in what they say is 1,453 safety incidents over a 4-year period. And what we know is that the Lampard Inquiry has been looking into Oxevision in different trusts, and we may get some recommendations on it.
OK, Rob, thanks very much indeed for that. Other stories making the news.